Dawn here, Women's Ministry. Today we're going to talk about 50 years old. Life through and beyond menopause. So it's about menopause and women who are older. In this topic, with menopause and perimenopause are challenging transition times for any woman. We're going to learn to help women go through these physical, emotional, and spiritual challenges successfully by having the change. Learn signs and symptoms, realistic expectations, and what it is and what is normal. In this lesson, it touches on issues of traditional medicine, diet, exercise, and herbal medicine. Now here I'm in my older years, heading towards 65. But with my life, I found going through changes a lot challenging too. I ended up being in menopause at the age of 40. That's a very early age. Usually age anywhere from 50 to 65 is usually the time where they start menopause, or sometimes if they have health issues, it comes a lot earlier, or maybe that they've had surgery. So we're going to talk a little bit about this. And a lot of my information is from Joseph Mayo, MD, and Mary Ann, who's a counselor with Women's Ministry. So, I'm just going to start out with grieving. So that's usually when your children are grown up and, they move out. Grieving at midlife. How do you feel at the age of 60? How are you doing? In other words, how do you feel? Do you feel good? How are you doing? Are you still continuing to work? Are you satisfied with your life? If you are, that's good. But for some people, grieving at midlife, people have problems and they start grieving. Oh, I'm old, I can't do anything. And sometimes they have deterioration of their health. Or maybe they find that their parents are having problems with their health. Some changes in life can happen, like the children living at home. Maybe they're having health issues. Maybe their career is kind of stalled and stale. Maybe they have an illness of a spouse. Maybe they had a stroke at this time, or heart attack. But the Bible talks about aging too. In Proverbs 20:29, and it states, ripening fields, so thoughts of aging, ripening fields for body and soul. So this is, how does your body feel? How does your soul? In Proverbs it says, the glory of young men is their strength, gray hair, and splendor of the old. So it does talk, getting old does talk about things in the Bible about you getting old. So it's basically a ripening of your age. It's not the end, it's just your ripening. The smell of good fruit. That's what I call it. Because when your fruit get ripened, don't they let off a nice smell, scent, like an orange or an apple? They do. So that's telling us it's ripening. And with people, we're ripening. So it lets off a good scent. Not aging, but ripening. At this time, we could say we can reprioritize our life. Mortality. Not aging, but ripening. So things can be changing. If we're not prioritizing, then we have morality. We can include nutritional supplements like tea and soy. Supplements? I take supplements. Vitamin B12 is what I take for my muscles. Of course, there's other supplements too. We should pace and exercise, which helps us reduce stress. So it's reducing stress that's on our bodies. At this time, we should be evaluating our health and health needs. Because as we get older, we already know our body is changing. Nutrition for body and soul. Well, how about medicines? Are you on taking medicines at this time? Are you just taking supplements? Sometimes we end up taking both, don't we? Reframing the concept of age, plus the roles that we live. It's a little bit about psychology. Like a ruler of the roost syndrome. What does that mean? Have you always been a leader in your community? Yeah. A woman who is used to being the leader of the home or a leader within the community. They may think or say things differently now that they're older. Like, I can't do it anymore. I don't want to do it anymore. Or you could reframe it and set new goals. Something that is more contentment and optimal with your health. I do a lot of things at home. I don't drive anymore. And it's because of my health. So I do a lot of things at home. And I just kind of take things of what I can do and still want to do as I'm aging. So I come up with ideas. Come up with personal dreams and how you can adjust. Start small and grow. How can women treat themselves better? Well, rest. Every once in a while, I'll go lay down and I'll take a nap because I'm tired. Because even working online and at home, I still get tired. I get up early. Take quiet times. During my quiet times, I like to pray or read the scriptures. At this age, we can be less responsible. Take time for ourselves. Kind of take a look at our soul, our body, mind, and soul. How are we doing? What do we need to change? And take that idea to change it. Pay attention to our health. Now, I've had 2 TIAs, which are mini strokes so far, and I'm heading for 65. So that tells me that I have to take care of myself. Plus, I have a small aneurysm in my brain, so I don't dare drive anymore. Plus, being on Social Security, you don't have a whole lot of money, so you really can't afford to buy a brand new car. So I have to pay attention to my health and do some changes. Some of these changes are, you know, are really a big change or it could be a small change. My grandmother, when she was going through her change, she'd fall downstairs or just plain fall. I kind of graduated with that one too. I fell downstairs, but I also have fallen. So I have to be careful because I get dizzy. Yeah. So we gotta pay attention to ourselves, take care of ourselves. So let's define menopause. It's a natural process for us women, and it's experienced by all women, signaled by changes in the reproductive system, hormones. Chiefly, it's an estrogen, progesterone, and testosterone. Those are your three hormones. Technically, a postmenopausal woman no longer has viable eggs and ovaries and has not had a period in a year. Well, if I'm going to be 65 and mine stopped in 40, I'm way past menopause. I'm postmenopause. So premenopause, for you women that are premenopause, also is known as a primary ovarian insufficiency occurs when so premenopause, also known as primary ovarian insufficiency. Oh, it's premature, is what it is. So it's insufficiency that occurs when menopause starts to happen before the age of 40. So that's what a lot of things, and because by many factors, it can be caused as a result of medical or surgical interventions, genetic. Sometimes it's genetic. Now I know my mom and my grandmother weren't didn't start their menopause early. They started theirs around the age of 60, 65. So I don't know why I started early. Could be a genetic, could be autoimmune, maybe infection. Smoking can cause it. Poor health or cancer can cause premature menopause. I know that I had a couple of surgeries on my female organs. They called it spring cleaning, where they had to go in and clean out all my organs, female organs, because I had a female disease, and it caused me to become sterile. So, I'm not sure what the name of it is. Endometriosis, that's what it was. So, and I think that might have been the cause of my premenopausal problems. They even did a blood test on me, and they found that my hormones were very low. So that could be very well. So always get checked up every year. And if you're having problems, make sure you take care of your female organs as well as the rest of your body. Premenopause. You usually have normal periods, but not enough eggs. So it's before refers to before between the start of each period until menopause. So premenopause is before you start your menopause. But you still usually have periods. Perimenopause is 5 years before periods actually stop, and often the most symptomatic. It's around menopause area, but it's 5 years. It can start as early as 5 years before you're in menopause. And then menopause is a cessation of periods for 20 or 12 years. 12 months. Periods stop for good. It's usually age 50s and 60s. It's a natural occurrence. I had dizziness. These are some symptoms. Mood changes. Sleepless nights. I still have sleepless nights. Sweats, like hot flashes. Brain fog and dryness. And dryness is your vaginal dryness. That's what they're talking about. So, what happens when you're postmenopause? You have no periods. There are no more eggs. You're done. Your eggs are completely gone. So what can we do? Women's health after menopause. This is some of the things we can do. We can do hormone replacements. We can ask for a request to have a blood draw. See how our hormones are. But some of the other things we have to look out for too. So when after menopause, we have bone loss. Some people are at risk for heart disease. Talk about hormone replacement therapy. This could be depending on your history. It could be your family history. It could be your history of things that you have developed in your health. So they want to do a history first before they even can go ahead and start that therapy, because sometimes it causes more damage to have the therapy than to not have the therapy. Check with your family. What's your family history? What's your personal history? And this should be medical history. So we gotta be careful when you do the history part. So signs and symptoms. An average age that you'll start feeling some of these symptoms is around the age of 51. Irregular periods, hot flashes, that's your temperature control, interrupted sleeps, generalized dryness, UTIs, anxiety, anger, emotional liability, that's anxiety, anger, and depression. That's and then also brain fog, memory problems. Sometimes they can, if they can't do therapy, they might put you on like a Prozac. They put my sister on Valium to help her. It's because of her emotional problems. when she went through hers she did through hysterectomy. She had a hysterectomy, so they didn't put her on Prozac, they put her on Valium, and then weaned her off. You have to discuss these things with your doctor. Don't just try to do things on your own. Sexual problems. Usually that's because of the dryness, and talk to your doctor about that. Maybe you can get some lubricants that may help with sexual pain. Talk to your doctor about brain fog, memory loss. What are some of the things that you can do? And if you're on other medicines, remember that if you're on other medicines, are these other medicines gonna contradict what these medicines will do to you? So you have to have that talk with your doctor, and also get checkups. So other risk symptoms are, like I said, the heart, osteoporosis, bone loss, hot flashes, muscle pain, like where you get a cramp in your leg at night. Also, one thing that I learned, weight gain. I gained a lot of weight when I was postmenopausal. So it kind of makes women miserable, doesn't it? Again, cardiovascular. Make sure you have a checkup. Make sure they check your heart. Make sure there's no problems. History on osteoporosis. Do you have a family member maybe that you have within your either intermediate family or even outside the family that you're related to? If you see a humpback, that's an indication of osteoporosis. That might be your history, and so it's something to watch out for. Now, I did talk about memory loss or brain fog, but also Alzheimer's disease, dementia. Other risk factors are diabetes, because of the weight, probably because of the weight gain, colon cancer. So make sure you get a full medical evaluation to understand your whole baseline. That's recommended every year. Gather information, which is your baseline health, and we call that FABLE. Family history. F stands for family history. Make sure you have breast exams every year. Breast cancer. Family history, there's a lot of genetics. So, if you have a good genetic, you're doing good. But some people don't. Lifestyle. Are you healthy or are you not healthy? Do you go to McDonald's every day? Or do you eat foods from home that are more nutritious? Get a black and white information. Have your blood drawn. That will help give you a black and white history of what's going on with your body. That tells you a lot. Your blood tells a lot about you. Laboratory results, black and white. Get it done. Understand what your body is going through right now. Estrogen is needed for to heal the heart. Also, that's a C-reactive protein. Micro particles that are going on. Find out what your cholesterol levels are. Are they good? Are they bad? Are they high? Are they low? So try to find out what your cholesterol levels are. Those are some ideas too. High sensitive C-reactive protein, and usually they take those after you've had a heart attack. Some people can have silent heart attacks, so don't think that it's not possible, because it is. DEXA, D-E-X-A, bone loss, bone density. My mother had that. My mother had was tested for that, and they found out that her back was broken in 3 different places. So they were treating her with medicine after they did the DEXA on her to find out. Find out first before you have that DEXA bone density test to make sure that your insurance will cover it. Some do not. Find and understand history of Alzheimer's, maybe diabetes. Usually people with big tummies like me, they have, they're known to have heart disease and diabetes. So we gotta exercise, take medications, eat right, and I still have a fat tummy. So I'm still at risk for heart problems. Have an A1C done every 6 months. Just check your A1C for diabetes. Now mine kind of went a little bit different. I started at 12, went down to 7, and went back up to 9. So I did something wrong here. Maybe it's food. So we need to have our A1C blood check to see how our levels are. They do a Prando, which is a 2-hour insulin, to see how your insulin's reacting. And usually they have you eat a lot of sugar or sweets or something like that. It's a 2-hour test. Get a colonoscopy, especially when, if you're having problems, even before you're 50. Do a colonoscopy. Make sure you don't have any colon cancer. Get a THS test for thyroid, because menopause can definitely cause problems with your thyroids too. So we gotta have those checked, see how those are doing. Aging well. That's what we want to do. Age well. Healthy lifestyle choices. Eat a healthy, balanced diet. Remember when as kids, parents would say to us, eat all your vegetables. Eat all your vegetables. I know I said that to my kids, and now I'm 64, and I have to tell myself to continue. Eat all my vegetables. Get rid of the oils in your pantry that are not good for you. Use olive oil or coconut oil. Those are the 2 good oils you could use in your diets. I use both of them. I'll even use coconut oil sometimes and put it in my hair when my scalp gets really itchy and dry, I'll use that and then I'll wash it out with regular soap the next day. I'll leave it in overnight. Yeah, I use coconut oil, put it in my hair. I mix it with honey. Honey works really. So half coconut oil, half honey. Mix it up into like a whip. Put it in your hair and then leave it in overnight. Make sure you don't wear a real good shirt because it tends to drip onto your clothes. And then I put a cap on and use it, wear it all overnight. Take my cap off and wash it. My hair is nice and shiny and soft. So, get a little hint there. Eat reasonable portions. Remember the 1/3 rule. Maybe a fist or a palm of proteins, grain, vegetables, fruit, green tea, or soy are the best. So fruits and vegetables, remember, 1/3. Drink green tea. Green tea is good for the heart. Increase your soy foods. Take vitamins. Now with the vitamins, don't buy the cheap brands. Buy the brands that they might be a little bit more expensive, but they're better for you. Make sure you get a mammogram every year, starting at the age of 40, at least once a year or once every 2 years. It's once every 2 years when you're 40 and once a year when you are after you're 50. Pap smears up to the age, even at the age of 50, every couple of years, get a pap if you can. Use exercises. Now, I know that they have senior exercises where you can sit in your chair and do the exercises. I find them on YouTube all the time. And with that, it helps with weight control, stress reduction, reduces heart problems, and osteoporosis. I lost my page. Also helps it also helps with hot flashes. You don't even have side effects of that. It helps with depression, memory loss, breast cancer risk, and risk of stroke. So if you're just sitting, you're taking a risk of having a stroke. So try to get to moving around. Move if you can. Another thing, if you can't do floor work, which I can't do, once I'm on that floor, I'm done. So I try to use the senior chair exercises, or I'll use Tai Chi, the beginner's Tai Chi. I don't use the more advanced one, because then I can move, at least I'm moving, and keep staying healthy. And it also lowers my diabetes too. Nutritional interventions for healthy aging. Like I said, use a good vitamin. Even a vitamin for over 50. Make sure you have a vitamin that has calcium and magnesium, a high B complex. You can take flaxseed too, which is good. That's a good herbal. Vitamin E is also good. Vitamin E helps a lot. Or, no, vitamin B helps a lot with your muscles. So, make sure you get something with vitamin B too. I take vitamin B12 to help with my muscles. Vitamin E is for brain function. Folic acid, you can find those in flaxseed or walnut. Essential fatty acids. What I do is I take fish oil supplement. But if you don't like the fish oil supplement, salmon is good. Mackerel is another one. Salmon's the best. Glucosamine for arthritis. That's a good herb for arthritis if you have arthritis. Or botanicals for healthy aging. Like if you're going through hot flashes, black cohosh root for helps with hot flashes in the heart. Chastity berry if you're still having periods and still having premenstrual syndrome. Chastity berry helps with that. According to risk or symptoms, valerian root helps with sleep assistant, or what I do is I take melatonin because it's safe and it's not addictive. Kava kava, if you're struggling with anxiety or panic attacks. Ginkgo. Ginkgo is good for poor circulation, for memory, and keeps hands and feet warm. So if you have cold hands and cold feet, ginkgo helps with that as well. St. John's wort. If you suffer with depression, St. John's wort helps with that. Hawthorn leaf. Heart and vascular. Horse chestnut. It's a thing for heart and vascular. But again, I'm going to tell you, please make sure you talk to your doctor before you start any of these botanicals. Natural hormones. Ginger. Ginger, garlic. Those are good things to use in your dishes. Ask your doctor about creams available at the health store. Or if you have to find out about pills and gels by prescription. Sometimes we have to take medications. And if you don't want to take medications, see if you could take a botanical or herb, or natural estrogen. It's another one. Sometimes we don't always want to take all these kinds of medicines. But if you do decide to take herbs, make sure you put them on your list of medications so that in case there's no interaction. Hormone replacement therapy. It relieves symptoms like estrogen and progesterone. Also estrogen only, those hormone replacement for those who still have their uterus. Some of us women, like my sister, she doesn't have a uterus. She had a hysterectomy. See if you need to have a testosterone replacement. Serums, designed for estrogen, it's to build your bone. Low dose oral contraceptives, those are for women who still having the periods and need to keep them regulated. Spiritual aspects of aging. Reevaluate your life. How's your life going? Have a time of reflection. Why spending money is not satisfying. That's not an option. You find this in Isaiah 55:2, that spending money no longer satisfies you. But in Isaiah 55:12, it says, why spending money is not bread, and your labor on what does not satisfy. So that's part of the Isaiah 55:2. Listen to me, and eat what is good, and you will delight in the richest of life. So your time is changing. Let go of what is not working for you. Just let it go. Find out some of the changes that you can do. Let go of what's not working or meaningful to you, and find out what is meaning for you. This is 55:12. You will go out in joy and be led forth in peace. The mountains and hills will burst into song before you, and all the trees of the field will clap their hands. Set free of what is no longer important, and find out what is more important for you. So, what do you want to do with the rest of your life? Find a new purpose. You're getting older, and there's still so much you can do. Come up with some ideas. Pray to God about it, and let God lead you to your next journey. I hope this helps with learning a little bit about menopause and getting older. Till then, the Lord bless you and keep you, and I pray for your journey for the rest of your life. God bless. Bye-bye.